My name is Dr. Ian Storch. I'm a board-certified gastroenterologist and osteopathic physician, and you are listening to DO or Do Not. If you are interested in joining our team or have suggestions or comments, please contact us at doordonotpodcast.com. Share our link with your friends and like us on Apple Podcasts, Facebook, Twitter, and Instagram. We hope you enjoy this episode.
Hello, my name is Pia Garawal. I'm a second-year medical student at Touro University, California, and I welcome you to today's episode of Do or Do Not. Today's guest speaker is Dr. Vania Manipod. Dr. Manipod is a board-certified psychiatrist and graduate of Western University of Health Sciences. We reached out to interview Dr. Manipod because she's the editor-in-chief of the DO. The DO is an amazing publication by DOs and osteopathic students which contains columns written about medical school, government advocacy, and life outside medicine. Definitely check it out. Further, we speak to Dr. Manipod about her practice of psychiatry. In this episode, she delves into the intricate world of psychiatric care and shares insights from her training journey, addressing the pressing issue of burnout as well as her experience in advocacy and entrepreneurship.
Vania, thank you so much for being with us tonight.
Thanks, Ian. I'm happy to be here.
So let me just start with the reason that we asked you to be on the podcast, on top of the other super interesting things that I want to talk to you about, is because you are editor-in-chief of the DO. So can you tell us a little bit or a lot about the DO, about what the group does, about what the publication does, and how you became editor-in-chief?
Right. So the DO, which I hope a lot of you read, is an official publication of the American Osteopathic Association. It's actually been around for a really long time. It used to be in print, but then it switched over to being primarily an online publication. In the past, it's mostly focused on topics that are really pertinent and relevant in healthcare and specifically to osteopathic physicians. But more recently, when I joined and became editor-in-chief, oh gosh, I have a horrible sense of time since the pandemic. 2 years ago, when I joined and became editor-in-chief, it switched. We rebranded and became more of a focus on DOs, osteopathic students, actually writing the columns, writing the articles, so it's in their voice. So it's definitely reflective of the osteopathic voice and topics, current events, research and stuff that's all, or policy, everything that is relevant to us as osteopathic physicians. So that was the most recent change. And my role as editor-in-chief, it's pretty exciting because I'm the first DO editor-in-chief, to my knowledge, for the publication. My role is mostly to provide guidance as far as topics, approving articles that go through before getting published, coming up and helping brainstorm ideas to include in the DO and our future publications and future issues, while also being part of and also leading the editorial advisory board, which consists of osteopathic medical students and osteopathic physicians. So we have about 40 editorial advisory board members, from students to current attendings to retirees. That's the difference, is we're trying to target all phases of our education and training, and also retirement as osteopathic physicians.
Yeah, so I have to say, Vania, like my bandwidth is a little short because I'm a busy clinician, but it gets pushed to me and I read it and I love the articles. Our listenership is mostly pre-medical and medical students. And I think for them, there's a huge amount of content, right? And it's great.
Well, thank you. I believe it's shifted because I'd say the majority of our readership was medical students. And I think it's great. The students are so enthusiastic and love contributing and love writing. I love it. But also what we wanted to do was also target especially the retiree population. We wanted to definitely incorporate them also when we rebranded. So I'm hoping that we can cover more topics that are relevant like throughout our career.
It's awesome. So, and if people want to find it, just before we go off this topic, obviously they could Google the DO, and I get it pushed directly to my email, which is great. But like, let's say someone was listening and they're like, wow, this sounds really cool. How would they find the publication? And if they wanted to get involved, maybe writing articles or something like that, like how would they do that?
Yes. So it's the do.osteopathic.org is where you can go directly online to the publication and read our current issue. And then if you want to get involved, our email is the do@osteopathic.org. So you can pitch ideas. You can say, hey, I'm really interested in being a writer. We have a writers group where we submit topics to a group of people on our listserv and say, hey, are you interested in writing about this topic? So there's definitely many different ways to get involved, and we're always open to hearing suggestions, constructive criticism, topic ideas, because this is for you. This is really for the osteopathic community. So we want to know what's important and relevant to you. And I know, especially, I think students and people earlier in their career and training, a lot of people are really interested in doing more than just specifically working in the hospital or working in the clinic. A lot of people want to foster their interests in writing. So this is a great way to kind of jumpstart your writing career and just have some articles that are published and visible to the public.
Again, I love it. If I don't like something, I'm not good at being fluffy bunny, but I listen to it. I love it. It's great. And I think everybody listening should check out the site.
Thank you, Ian.
Pleasure. It's awesome. So my next question for you, when I looked into you as editor-in-chief, I also found that on the side, and you do a lot of different things, you have a blog called Freud and Fashion. Can you tell us a little bit about that?
Yeah. So interesting. I started my blog, Freud and Fashion, in 2010. I was in residency. That was when fashion bloggers actually started becoming more popular around that time. So it was a long time ago. And I did it as a way of kind of building community, also because I had moved away from my family and friends for residency. It was pretty lonely. I was actually pretty depressed. And I thought, okay, I'm just going to try this blog thing and see what comes about from it. So it kind of evolved from me trying to be a fashion blogger, which is horrible because I'm not a fashion person at all right now. But back then I tried to be. And then it evolved into talking about my life as a psychiatry resident in training, because you don't really hear much. Back then, you did not hear anything about residency, the hardships, the realities of it, the anxiety, the depression, the difficulties working with patients, and trying to learn how to best work with patients and learning about yourself at the same time. Like, nobody talked about that back then. So it kind of evolved into that. And then actually how it got the attention of the American Osteopathic Association was when I graduated, became an attending at my first job out of residency. I actually decided to open up about being burned out as an early career physician. I posted it on my blog first and decided, I'm going to submit it to Kevin MD, see if it gets published. It got published. It actually got a lot of shares because nobody was really talking about it at that time, like being a burned out, depressed psychiatrist. I mean, whoever hears about that? And that's actually how I got the support of the American Osteopathic Association. And I started speaking at OMED, talking about burnout in 2015, I think. So it all really progressed into trying to be this cool fashion blogger to actually being my pathway to becoming more recognized as a DO, as someone advocating for physicians and medical students to be open about talking about mental health more, because it wasn't really being discussed back then.
The blog is awesome. And I see that you speak a lot on medical burnout at conferences. I think that's great. So I'm just going to take the opportunity to kind of pose a question to you that sometimes I have a little problem answering. Burnout is obviously something that's come to light, which is great. And I think students are very aware of it. I think work-life balance obviously is a sort of a catchphrase that comes up all the time. One of the things that I struggle with is many times students come to me for advice and they basically frame something like this. They'll say, I want to go to medical school. I want to be a cardiothoracic surgeon, and I really want to avoid burnout and have a work-life balance. And again, I told you I'm not very fluffy bunny. So kind of my perspective is you have to pick what your goals are. And if your goals are to be home at 3 o'clock and in the park with your shoes off, enjoying the turf, I mean, that's fine. But probably being a cardiothoracic surgeon is not going to be congruent with that. Maybe you just have to look at your goals and what you want to do with your life. So do you think that's harsh or do you think that's good advice?
I don't think that's harsh at all because it's the reality for a lot of specialties. Because I think back then, none of us really picked a specialty based on lifestyle. But I think especially now, since psychiatry has become more popular for that and various other reasons, I think it's become more of a priority now. So I don't think that that is harsh at all because it's real. I don't know. Do you know of any cardiothoracic surgeons or neurosurgeons who have excellent work-life balance?
No, they're all terrible. Half of them are divorced, the ones that I know. Sorry, guys. But, it's rough. My best friend is an interventional cardiologist, and I talk to him usually at like 5:30 in the morning while we're driving into work, and then again at like 8 o'clock at night when we're driving home. So neither of us, I mean, thankfully, neither of us are divorced, but we don't really have a great work-life balance, and that's just part of our job. And thankfully, we like what we do, and it works, and we have spouses that support us. But again, I think as people starting off, part of preventing burnout, and again, sounds like you agree, is just picking a specialty that, maybe orthopedics isn't for you. Again, if you don't want to go down a very competitive path and put in a ton of time getting there. Yes?
Right. I think that is a very good point and an excellent point to give to medical students. I do wonder though, because I feel like this generation is a lot more definitely thinking about work-life balance, but I think also wanting more side gigs and being more entrepreneurial. So I've seen a gastroenterologist who works for tech and then also teaches. And, I think it's with social media, you start to see all the different ways that people kind of divide their time, even in perhaps specialties that are known to have the worst work-life balance. So I do wonder, though, if that is possible. And I think if someone really wants to be a cardiothoracic surgeon, but also wants to have better work-life balance, I guess they have to explore like more of the business route as well. So maybe that's possible. I don't know.
So
Yeah,
I'm going to transition a little bit. Now you're in private practice, is that right?
I am. So I actually divide my time with multiple different things. Like I founded my own small little boutique concierge like practice where my niche is actually taking people off of psychiatric medications. That's new. And then I'm also an independent contractor at a private practice where I do take insurance and I see adults for psychiatry. And then I'm also a chief medical officer for a mental health tech company, and I'm the editor in chief. So it's like you can create the life that you want. It's totally possible.
Right.
So I do multiple different things.
So like you could advise a cardiothoracic surgeon on how to compartmentalize and do all these things, right?
I think if they want to, I think it's possible.
Obviously no HIPAA violation, but tell us a little bit about what your week looks like and specifically what type of patients a private practice type psychiatrist would see.
My schedule or just in
Yeah,
general,
yeah,
a
your schedule.
psychiatrist?
No, your
Okay.
schedule. Tell us what you do on the week. And then specifically, if you don't mind, tell us a little bit about maybe some specific or general, what type of patients you would see with what type of
Oh,
problem.
okay. Sure. So let me just preface this that my schedule is a mixture of things because I was burned out. I think a lot of times when people are afraid of burnout, they think it's a failure of themselves, which is completely understandable. We all go through this process if we do experience burnout. But for some of us, it could be a very positive thing, like it was for me, because it made me realize, you know what? I don't want a standard job where I'm working for somebody else. And that's pretty much my week, right? Is seeing patients every single day, 8 to 5 p.m. So after that experience, I found ways to really create this different type of career that works best for me. So let's start with what we're more familiar with. So I see patients in the other private practice I work for 2 days a week, Tuesday and Friday. And then I have my own tiny practice that's a telepsych practice, and I see patients on the other days. Yeah. And then I have editor-in-chief stuff that I do a couple hours a week, kind of reviewing, drafts of articles and responding to emails with the DO team. But every single day, the startup life as a chief medical officer for this AI app that we're creating for mental health, that's like every day. So my day is never boring and it's very unpredictable. So that's my week.
Sounds cool.
Yeah.
So now tell us about some patients. Like, tell us about what type of patients you would see, and maybe one specific patient that you can remember from this week or last week that was interesting.
So I see everything as a general adult psychiatrist. So the most I see is, of course, anxiety disorders, major depressive disorder, and bipolar disorder. I have to say, because my niche has evolved, so in all practices in the other practice, I see patients to help them taper off of psychiatric medications, in addition to prescribing them. I'm not against medications, just to be clear, but it's always interesting helping my patients come off of psychiatric medications because everybody's different and everybody responds to lower doses differently. It's a lot of education about what they start to feel being off of antidepressants and psychiatric medications for the first time in their life. So there's not only physical and chemical withdrawal, but there's also a huge adjustment psychologically and behaviorally when coming off of these meds, because a lot of them feel like they need these meds in order to feel normal. So when they suddenly start to experience emotion, which is very normal, it feels strange. So I have to say that that's always interesting to me to see how people evolve coming off of these medications.
So let me ask you about this. It's great, I think, in the last 5 to 10 years that therapy has become mainstream. And I think most people probably need therapy, and that's okay. Just the point that like people have problems and talking with a professional is helpful. It's not a sign of weakness. And my question is, when someone is looking for a place to get therapy, the choices of provider would be a psychiatrist, a psychologist, or a social worker for the most part. Can you just tell us a little bit about what the differences are and maybe when a psychiatrist would be better or maybe when a different provider would be better?
Mm-hmm. Yeah, I get this question a lot, specifically, what's the difference between a therapist, or they always say psychologist, because psychologist, even though there are multiple different degrees for therapists, psychologists, LCSW, LMFT, LPC. So it's always a question of when do I see a therapist versus when do I see a psychiatrist who is a physician? And I always tell people, if you're not sure, because most people don't know when to go to either one. I always say, if you're not really sure, go to either one. And either one is trained to tell you, look, maybe therapy might be more appropriate for you. Maybe medication's not necessarily at this time. Or if a therapist feels like medications might be beneficial in addition to therapy, they will direct you to the appropriate one. Now, with the shortage and the wait list of seeing a mental health professional, of course, you want to pick the right one first. So I always say, if symptoms are more severe to the point it's really negatively impacting your ability to function, then always start with a psychiatrist first, because you can't really go wrong. I think a lot of people are worried about seeing a psychiatrist because oftentimes people assume that they're going to push medications, which is true in some cases. But I have to say, for many osteopathic psychiatrists, a lot of us with our training, and this is nothing against allopathic psychiatrists, I'm talking specifically about our training. Oftentimes we do, and I've been told that we do have a different approach where we're not just immediately prescribing a medication. We may recommend medications, but then we're always suggesting other holistic approaches, lifestyle changes, therapy, etc.
That's awesome. That's perfect answer.
Okay.
Vania, specifically talking about shortages and difficulty getting appointments, from my own perspective, I always think it's interesting that a few years before I went into gastroenterology, I was told they couldn't give a GI fellowship away. And then, about when I applied, it became super competitive and has sort of stayed that way. And I feel like when I was in medical school, psychiatry was not a very popular specialty. And I think the interest was low. And now it's like every other student that I talk to wants to be a psychiatrist. Can you tell us a little bit about what you think of that shift and why it is?
Yeah, that's an excellent and very interesting question. So when I applied for residency in 2011, so it's been a while. Actually, there were like 13 people who matched into psychiatry, which was really unheard of. That was a lot because for the most part, psychiatry was not popular back then at all. And I think it's because nobody really talked much about mental health back then, definitely compared to now. I think this is just my theory. I have to say, especially since I've been involved with social media since residency, I've seen how it has evolved into becoming something that is more openly talked about, especially with social media, more people sharing about their experiences, more people talking about wellness, which is kind of a diluted word these days, but wellness, mental health, well-being, self-care. And I think also with what we were discussing earlier with the importance of lifestyle and with more education out there about burnout and all of that, I do feel that's led to an increase in interest in psychiatry. Psychiatry also, I have to say, is very cool. It's not a Gen Z term anymore. It's fire, I guess. I don't know. I'm not going to try. I think because there's so much left to be learned and discovered about the mind, I think people are more starting to become more comfortable with that gray area of medicine. I guess it's not so concrete as like ordering labs. I think people are more open to that these days. And the creativity maybe with psychiatry. I don't know. It's a really interesting thing, but I do feel like the more people are talking about mental health and the importance of trying to have a life outside of medicine, I think is what's drawing people more to psychiatry.
It's amazing. Yeah, it's just amazing. It's like everything is kind of cyclic and psychiatry has come into its own, I feel like, in the last few years.
Yeah.
I'm going to shift gears a little bit, Vania, and we're going to talk a little bit about you, if that's okay. So can you tell us where you grew up and when you decided you wanted to be a doctor and became interested in medicine?
I was born in Fort Bragg, North Carolina. My dad was in the military, but I moved to Southern California, Glendora, California, if anybody knows that area, and grew up in Southern California, Rancho Cucamonga. But because my dad was in the military, we were fortunate. We didn't have to move as much as a lot of military brats. So I mostly lived in Southern California and Northern California. So I'm definitely a Californian. So I'm the oldest of 33 grandchildren, and this is relevant because I'm Filipino American. In the Philippines, becoming a doctor or a nurse or is very prestigious. And my grandfather, who was my mentor and pretty much taught me everything, like tried to teach me and everything at a very early age because he was an elementary school principal. So he taught me to read early and everything. He wanted me to be the first doctor grandchild in the family. So that was a lot of pressure. So I always tell people this. I'm like, I just did the pre-med stuff. I took the MCAT and I thought, you know what? We'll just see if I get in. Because deep down, I really wanted to be a newscaster. That was like my dream since I was age 7 to become a newscaster. And I just did pre-med as my backup plan. But then my grandfather, he passed away from cancer. And I found out that he passed away when I was sitting and taking the MCAT. So I failed because I found out he passed away during my lunch break. I failed the MCAT and I went through like this whole dark phase of being confused about my life now, because now all of a sudden that pressure that I felt like to kind of please my grandfather, make him proud, it was gone now that he had passed away. And with that freedom to really think about what I really wanted to do, I realized, you know what? I think I'm actually meant to become a physician. So I applied for medical school, and in my mind, because a part of me wasn't completely set on medicine for the longest time, I thought if I apply and I get in, great. If not, then I'm just gonna, I guess, try and be a newscaster, news anchor. But I got in, and in my mind, I realized like this is what I'm meant to be, and this is how I can make a difference, especially once I realized that psychiatry was the specialty for me. I felt like I could really make an impact in the profession and on people's lives as a psychiatrist.
That's amazing. The story about the MCAT is awful, obviously, but I'm going to rewind just a little bit. Tell us where you went to college, and then specifically how you were introduced to osteopathic school, or how you learned about osteopathic school.
Okay. So I went to college at University of California at Davis. So I became interested in osteopathic medicine when I was really researching the difference between allopathic and osteopathic medicine. I am going to be honest. I applied to both MD and DO because I just wanted to be a physician. Honestly, I didn't care. I was like, I'm going to get in where I get in, wherever I get in is where I'm meant to be. And I got into 2 osteopathic medical schools. So, and I will say that when I was in medical school, I went to Western University of Health Sciences in Pomona, California. When I was in medical school, honestly, a part of me kind of resented having to do OMT classes and stuff like that, because a part of me was kind of like, how do I explain this? Because I'm obviously very proud of being a DO, but this is my process. I think I resented having to do all that. I think a part of me was still fighting becoming a doctor because I was doing horribly in medical school, and I failed my first osteopathic exam. So I thought I'm definitely not meant to be a physician, and I hate OMT. But then when I really looked into it and I did more research about osteopathic medicine and learned more about its history, which I did, obviously when applying and doing interviews, I researched it before. But when I finally decided, like, get out of your head, like, you're going to be a DO, really understand why osteopathic medicine exists, I did my own research and reading about history, and I just love that approach. It just really fits me. And I've done talks about connecting mental health and osteopathic medicine, and talking about how A.T. Still really incorporated psychology when he was creating the philosophy of osteopathic medicine. And it was just this growing process for me. And I mention this because I think there's a lot of the osteopathic medical students out there who feel the same way that I did. I want you to know, like, really understand where osteopathic medicine comes from, because we are definitely unique in our practice and our theory and our philosophy of practicing medicine. And it's definitely something to be proud of.
I think at the end of the journey, you're the editor-in-chief of the DO. So you have no question that you're committed. So I don't think anyone listening doubts that. But I think it's awesome to hear the process. And again, that's the whole reason for the podcast. Not everybody starts as the editor in chief of the DO. Like you have to get to that point, right?
Absolutely. It was definitely a process, but I'm here and I'm loud and proud, DO proud.
Was it during medical school that you decided you wanted to be a psychiatrist? And just to make one quick comment, I think if you were a newscaster, you speak very well and you have a great voice. So you would have been great at that. But when did you decide you wanted to be a psychiatrist? And then can you tell us a little bit about how you chose your residency?
So throughout my first 2 years, I was very conflicted because a part of me thought like I am not good at anything. Because I was not doing well academically. I was at the bottom of my class. I will say that because I know there's a lot of people there who feel like you have to be at the top of your class to get somewhere. No, I was at the bottom of my class. And it wasn't until the psychiatry block where I actually really enjoyed going to lecture at 8 a.m. I was like, I am so excited to learn about psychiatry. And that is the first time I ever felt that way in medical school. So I knew that there was something there. I honestly didn't know anything about mental health. I think the stigma of it being, of an Asian upbringing definitely like did not open my eyes to anything related to mental health and psychiatry. I honestly didn't even know it existed until that block in medical school. So that's one of the reasons. And then when I was in rotating throughout the hospitals as a third year, when I was in surgery rotation or internal medicine, I always got assigned the patients who had psychiatric issues. And there were some on the rotation, some of the patients on the rotation that they did this major workup on, couldn't figure out what was going on with the patient. I would go in there, actually ask about their life, what's going on, what stressors. For example, hyperemesis gravidarum. Patients like that, like they're like, patients not eating. We did all these tests. And then I would go in there and talk with them. And then next day, the report was, they're eating. Oh, did they keep it down? Yeah. So I was like, what? I could make patients better just by talking to them? Awesome. So that's kind of where I knew that was my calling. And I proved it to them. Look, psychiatry is important.
That's awesome. And then from there, you applied to psychiatry. Tell us a little bit about your application process, how you picked your residency, and then what that was like.
Yeah. Okay. So I was one of those people who was I am going to say this because I know a lot of us are conflicted at times. I was in a relationship. The person was in Southern California. My family's in Southern California. I was like, I have to stay in Southern California. So I applied everywhere, allopathic, osteopathic, because there was no combined residencies then or combined match. And I ultimately decided to stick with my comfort and went to a program in Southern California that was the first year it was ever opening. So when I applied, like I was one of the only ones who actually matched into the program, and there were a lot of open spots. So that was my process. And I'm just saying that because I know a lot of us are really conflicted about how to choose a residency. But in my first year as an intern, that program actually lost funding. That's what I was told. They lost funding. So I had to transfer to another residency, which is not ideal. And I'm talking about my diverting path because I feel like oftentimes medical students think like you have to have this completely linear path and that if you have to divert that it's a failure. No, it's not. It can actually lead to better things. So I ended up going to a completely new residency that opened in Oregon, Samaritan Mental Health. I was the first to graduate from that residency program. And at the time, the program director and the residency director who initiated it and kind of led the way in developing it, Dr. Mike May, became my mentor. And he was very entrepreneurial also, he was a psychoanalytically trained psychiatrist. So that really got me into therapy, and he emphasized the importance of psychotherapy too. So having your program director, I would say, can make a huge influence on your trajectory in your career. So that's why I'm huge in psychotherapy. especially psychoanalytic psychotherapy.
So you finished in Oregon, and what was your job search like? How did that?
So I did want to end up back in California. So that became my priority because I wanted to be closer to my family. So I mostly looked for jobs in that area. I ended up getting a job for an HMO. I will not mention the name, an HMO. And that's where I got burned out. Let's just say that.
So you're just unhappy, is that right? Or deeper than that?
Well, I think, and early career physicians, like the highest rate of burnout is for when you're an early career physician. So after residency. And a lot of people don't know that because I think a lot of people assume, yes, I graduated residency. This is where life begins. Oh no. Then you're hit with the reality of medicine and the limitations and the bureaucracy. And you're like, ah. And then you also lose the support network that you had extensively during residency. So that's a huge shift as well. So for me, it was that, I would say. In addition to that, I lost a lot of patients to suicide at my first job. I was working with a population. I did everything I could. I was working with a population that was high risk, and that was really took a toll on me. But in the end, I guess just my way and my ideals of practicing a psychiatrist did not fit with my employers. So that's when I got burned out because I think a lot of us assume that we're failures if we don't stick with our first job. And you're not a failure. I think you should view your first job as kind of getting an idea of like, do you like this type of setting or do you not? If not, be open to the idea of switching to something else that might make you happier. So for me, I did become depressed. I became burned out. That's why I decided to open up about my experience because I couldn't figure out why I started to hate psychiatry in my job because I love psychiatry. Why all of a sudden do I hate it? Why do I hate seeing patients? That's when I started to research and realized not many people talk about burnout. So that's when I decided to open up about it. And that's when it started to become more therapeutic and healing for me to also move on and find something that made me happier as a physician.
And after that, how long did it take you to sort of build to where you are now? And you seem quite I'm not a psychiatrist, but you seem quite adjusted and happy right now.
I'm definitely happy, tired, but happy. Who isn't tired as a physician? So just to share my process, because I think people sometimes want ideas of what other people did to kind of find their way. I went from full-time to per diem, working for the same place to kind of cut back and really think about what I wanted to do. Worked in a different private practice setting to kind of learn a different way of practicing and more of an entrepreneurial way because my friend was the psychiatrist and practice owner and he's an amazing entrepreneur. So learned from his style. And eventually I ended up moving and deciding, I think I want to start my own thing. So I think being an independent contractor, I listened to your Dr. Darko episode. So he talks a lot about this, about being an independent contractor. It's harder because you do have to figure out your own malpractice, your own savings plan. You have to do a lot on your own, which is scary for a lot of people. But I think I've helped a lot of people kind of find that way and, show that it's okay. It's scary at first. But yeah, becoming an independent contractor is scary at first, but it can give you a lot more flexibility to do what you want to do. So it was a couple years process, but I'm happy with where I'm at now and venturing and trying different things. And it's interesting and exciting.
It sounds awesome, Vania. And you're awesome. The conversation's been awesome. I really appreciate your time. We have one grand finale question that I'd like to kind of leave you with, which is, can you give us one piece of advice that you've been given from someone else that has really impacted you and you would like to share with our listeners?
Mm-hmm. So I'm open about having social anxiety, which is strange, right? Because I do a lot of public speaking, but oh my gosh, I've done more than 10 years of therapy to get to this point. Let me just tell you that. So one of my attendings, who was also my mentor from residency, he was giving this lecture on social anxiety and anxiety in general, and it applies to life. But he said, if you're going to overcome anxiety or basically anything in life, you want to avoid avoidance. It's so simple, right? Like avoid avoidance. Because I think when we get scared of something, when we get anxious about something, we want to avoid. So anytime I'm afraid of doing something, even something as simple like for me, going to the grocery store used to be anxiety inducing. I always like hear his thoughts come in my head, avoid avoidance. So that's what sticks because it's simple. So I think if it comes to anxiety, if it comes to wanting to do something but being afraid, kind of don't avoid it. Maybe instead kind of go for it.
I think that's awesome advice. Definitely something to live by. Vania, thank you so much again for your time. You've been awesome. And I really appreciate that you spend so much of your valuable time with us.
Thanks, Ian. I appreciate it.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there's someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tianyu She. Thank you guys so much for listening to Do or Do Not.